Welcome to the latest segment of Moments Off the Mat presented by USA Wrestling. I'm Corey James, National Team's athletic trainer for USA Wrestling. I'm joined today by President of USA Wrestling, Bruce Baumgardner, and USA Wrestling Executive Director, Rich Bender. Also joining us is USA Wrestling's COVID-19 committee members, Dr. Tom Price, John Bardis, and Dr. Bernard Feldman. Thank you all for joining us today.
Thank you.
To start off, I'll turn it over to Bruce for an opening statement. Bruce, thank you for your time today.
Corey, thank you very much. It's a pleasure to be here under the not so great circumstances, but as president of USA Wrestling, I want to let our membership know, the wrestling community, that USA Wrestling's number one priority is the safety of our members, elite athletes, team leaders, volunteers, and their families, the staff, and their families through this unprecedented times. And we believe we have a committee of experts and are doing our due diligence to provide safe guidance for the wrestling membership of USA Wrestling and the wrestling community. And very proud to be part of USA Wrestling at this time. And, I'll turn it over to Rich Bender to introduce the committee.
Thank you, Bruce. Rich, Bruce mentioned that we're going through unprecedented times. Why did USA Wrestling feel it's important to form a COVID-19 committee, and how did USA Wrestling select the members?
Well, early on, we realized that as this challenge presented itself not only to wrestling but society, we realized that we didn't have a core competency within our staff and in our group at USA Wrestling to really respond appropriately. And I think a lesson that we learned from 2013, when we were challenged for our spot on the Olympic program, was that we needed to assemble a panel of experts that could advise and help us navigate through this time frame. And we were so blessed to have some unbelievable talent within the wrestling ranks, so to speak. And when we initially talked to John Bardis, who many know John Bardis as not only an athlete, but maybe one of our greatest team leaders of all time, led our Greco-Roman team to our world championship. And John is, without question, maybe one of the most gifted and talented healthcare entrepreneurs in America. And we right away went to John and asked for his advice and his willingness to participate in a committee like this to help navigate us through these waters. John was an instrumental member and leader within the wrestling movement when we navigated those waters to stay in the Olympic program. And John was gracious enough to introduce us to a brilliant Dr. Tom Price when Dr. Price was serving as the secretary of the Department of Health and Human Services. Came to the Olympic Training Center, actually came right to the wrestling room, and I think we kind of hooked him right away. And John was gracious enough to ask Dr. Price if he would help serve on this committee, and without hesitation, Dr. Price said that he was happy to help, and so we were blessed with two home runs right off the bat. And then it was a no-brainer for us to reach out to Dr. Bernie Feldman, who is known around the world as maybe the most respected wrestling doctor maybe of all time, as he always does. Threw his hat in and said, absolutely, I'd love to help and serve in any way we could. So we really had an all-star crew from the start. And that was really felt like we needed to have a committee that was relatively small and we could communicate really efficiently and effectively, and just so incredibly blessed to have the talent that we have helping us navigate through this really, really interesting time.
Well, thank you, Rich, and thank you to the committee members for joining us today. We're very honored to have you here and sharing your insight as well. And with all the updates on COVID-19 changing as often as they do, can you maybe just describe what resources you're using to have up-to-date information and accurate information?
Okay, well, I personally, I'm Bernie, and I've been watching the updates that are given by the president and his committee dealing with the coronavirus. And there's an enormous amount of pertinent and helpful information that's given every day on those press briefings. There's a fair amount of medical information that's provided on those briefings as well. There's a website called cdc.gov. And if you go on that website, you'll see just an unbelievable amount of information. You know, how do you try to avoid getting infected? If you're with someone who is infected, what do you do to try to mitigate your chances of getting it? I mean, it's very detailed and it's very well done. DocWire News, DOCWIRE News, and then type in coronavirus, get an enormous amount on that. And I read those, and the combination of what I'm getting by email and what I'm able to pick up from the press conferences, I know a lot more about it than I did before I started.
This is Tom Price. I just want to say how thankful I am for the opportunity to join y'all. I have incredible respect and admiration for all the wrestling world out there, and so it's a real privilege to be associated with you. Dr. Feldman's absolutely right. CDC.gov is one of the best websites for accurate, real-time information on coronavirus. There's a broader one related to the entire government and what the federal government is doing, coronavirus.gov. It's a pretty good site. And then if you want to track this thing as it moves across the world, Johns Hopkins has a website that allows you to look at the numbers and see, and that's in real time as well. In addition to your state departments and public health, so those are the areas that I would look at. This is a new disease. It's something that we've got to kind of change our habits about, and so the importance of doing just regular public health measures, which are the physical distancing that we ought to be doing, the making certain that we're washing our hands, that we're not touching our face. Nobody ever dreamed how hard it would be not to touch your face, but it's important not to do so. It's an honor to be with you, and I can't tell you how much admiration and respect I have for the work that you all do.
Thank you. You mentioned social distancing. In addition to social distancing, can you kind of elaborate the importance of social distancing and any other factors that may contribute to the possible decrease of our chances becoming exposed to COVID-19?
If we all follow those are the best measures that are available that we're aware of to lower the risk of getting infected. I mean, unfortunately, there are people who keep questioning or challenging some of those guidelines. I think 6 feet is what's been recommended. If we all comply with that, I think that we will be successful. Even people who are young and healthy, if they don't practice this, they may come in contact with somebody who is infected and then take it home to someone in their house who is at higher risk.
Remember, there are two main ways that you can get this. One is by droplets, somebody coughing or sneezing and having the infection, and then it gets in your nose or in your mouth or in your eyes, and then it takes off. And that's why the distancing is so important. The physical distancing is so important. The other way is through surfaces. Somebody that's infected touches a surface, a doorknob, a table, a book with frequency, and you're around that area, and then you touch it, and then you touch your nose or your mouth or your eyes, and it gets introduced that way. So if you just think about how the virus takes advantage of you and gets inside you and potentially gets you infected, then you can see the kinds of things that you ought to be doing to make certain that you're at as low risk as possible not to get infected, and then we can stop the transmission or the spread of the disease itself.
That's great insight. If possible, in respecting the fluid situation we're currently in, would you be able to provide us with an update on where we are today and perhaps what the coming weeks might look like?
Yeah, this is really important because folks want to know the future. They want to know when this is all going to end. And the honest answer is that we don't know with certainty. It's a family of viruses that we've known for a long time. It's the same family of viruses that causes one of the common colds. It's the same family of viruses that has caused SARS and MERS epidemics in the past, coronavirus. But it's a new version of that. And so we've got to be able to study that and determine a proper treatment for it, as well as a vaccine for it. And I believe both of those will be coming. But that's going to take some time. So in the meantime, the only the way that we can battle this, that we can fight this, is through the mechanisms that are being recommended right now with the social distancing, the physical distancing, this washing of the hands, the not touching the face. If you feel sick, I think it's important. You ought to stay home. You ought not be going out. Remember, though, 80 to 85% of folks who are infected with this don't have an awful problem with it. They get mild to moderate symptoms, meaning that they get like a cold or a flu or a severe flu, but they don't have to necessarily be treated in any way other than you would normally treat yourself for a cold or the flu. And that's important to know, but you got to stay away from folks so that you don't continue to transmit the disease. How long is it going to last? If we look at nations that have kind of gone before us, the only real nation that you can look at with any certainty, although the numbers are suspect coming out of China, but China apparently has been through their curve. It took them about 3 months, 3.5 months from the very first diagnosis that they had until they were on the downslope of their curve. So if we look at ours, we're about probably 4 to 6 weeks, maybe 8 weeks away from that point where we're on the clear downslope of the curve. So I think over the next 4 to 6 weeks, we ought to see a significant reduction. I do think that with all of the resources that are being thrown at this, that we'll find some high quality treatment mechanisms for this. And also, imagine if you would, if we had a real appropriate treatment for it, then we wouldn't have the fear and concern about going out and requiring the physical distancing. That ultimately is going to require the immunity of many more folks, including through a vaccine, which is likely going to take a lot longer. I think a vaccine will likely be with us if by the beginning of next year or possibly by the fall. What we want to do is get through this spike and then be able to have some sort of treatment and make it so the next spike in the fall, which is likely, is not nearly as severe as what we're going through now.
John, a question for you about general medical equipment, getting more supplies and what that supply chain looks like.
Well, here, is the hard reality, and that is America allowed China to basically take over the manufacture of the critical PPE equipment that is supplied to the United States on a day-in and day-out basis. That has all arisen out of general logistic and inventory management and manufacturing practices that have led us to just-in-time inventory allocations across many industries. However, in the case, say, for example, food sourcing in the United States, we do not depend on other countries for our food sourcing. We're farm to table and have very extensive logistic and production capacities within our own borders. Just-in-time inventory and manufacturing really focused itself largely on cost reduction. And since China, in many cases, had state-sponsored companies to subsidize them, as well as lower labor rates, many portions of the healthcare supply chain relative to PPE product and even pharmaceuticals have been outsourced to China. I think we now realize that using maximally efficient just-in-time inventory capabilities, along with outsourcing the manufacturing of those products to an Asian nation across an ocean, has really presented some super large problems to us. As a result, we were caught flat-footed, didn't have enough PPE on site in many of our institutions. The strategic stockpile was really not designed for this kind of a problem that could affect literally every American community, and every American community is really backstopped on an infectious disease basis by the hospital systems or the health networks. And those health networks rarely have more than a few weeks of inventory on hand because of the cost of carrying that inventory. We now realize that that's a pretty big mistake. So the federal government has jumped in on this. Let me just underscore the point. It was never the federal government's job to ensure that the private sector had adequate or large medical supply reservoirs. That's just not how the federal government works. Admiral Brett Giroir is running this program. He has basically managed this now through the 3 major medical supply distributors that have 600 locations of distribution throughout the United States. We were really in trouble here. The administration has charted up their full available fleet of C-130 transports, and now has started to bring PPE into the country from China. Those products are being distributed from the distributors directly to the states. So if hospital systems are short on PPE, and each state has been different about how it's stockpiled the PPE for its state. Some have done a good job, some have not done a good job. And it's now up to the states to decide how they want that PPE distributed. So there is a system and a process in place today. We are responding. We're clearly late on this. We were behind, and you've heard about that on the various news networks. But I believe Admiral Giroir has solved for this in terms of a system that will now work to get it done. The federal government has stepped in, as I said, and we have bought directly millions upon millions of gowns and masks and so forth. Now, the challenge is and will be for the states to decide which of their hospitals at a given time, because of the onslaught in their community relative to the virus, need to have more PPE. So this thing is not a straight line. It isn't something where you can take a state population and say, well, Texas needs this and Florida needs that, and California and New York as the mega states need this. It's really depending upon utilization and the number of patients infected. So I feel on that front, we're doing a pretty decent job. We were behind, no doubt about it. It also underscores the weakness in a system that's based on fee-for-service healthcare, because on a fee-for-service healthcare model, you're paid for what you do. And so you're going to only stock enough supplies in your normal circumstance based on demand that you know. So we need to change that. I suspect that one of the things, Corey, that will come out of this is that the United States government will absolutely ensure that in the future manufacturing is back on our shore, that the full control of materials and supply will be on our shore. The other thing that clearly is a shortcoming is our testing capability. Abbott has stepped up this last week and come out with their molecular test, which requires a drop of blood, but it also requires a spectrometer, so it'll do it in 10 minutes, which means that you've got to have a hospital system or a health provider which has the cartridge, the blood test, and then puts it in a molecular spectrometer to know whether or not COVID is present. That's challenging because you can't do this just out of a kit. I think that's next. So clearly in the future, we have to have testing that is ahead of the curve. Until you know where the virus is and who the hosts are, it's very, very tough to do anything other than hardcore quarantine as a preventative measure. The nation definitely has had a wake-up call here on this particular virus on those fronts.
I wonder if we could ask each one of you, just looking at this platform as an opportunity for us to say something to the wrestling community.
Well, over many years, I have had the opportunity to watch and experience how hard the wrestlers work, how dedicated they are, how focused they are, the kind of sacrifices that they make in order to compete at this level. And it's hard to imagine, if you don't have that much invested in it like they do, what a devastating thing to have to face, that their Olympic dream has been deferred for a year. Some of these guys have planned for this and hoped for it their entire life. But the fact is, I understand how hard you guys work, the wrestlers, and I respect you for that. I admire you for that. But right now we're talking about, I don't want to be melodramatic, but this is life or death. I mean, our survival requires us to comply with the directions and the recommendations and the guidelines that are presented to us by our experts in this field. Right now, you have to kind of put your goals and dreams, as hard as it may be, you have to put your goals and dreams on the back burner and focus on getting by this next few months. There is light at the end of the tunnel. This is not going to go on for 6 months. I really believe that Dr. Price's estimate of 6 to 8 weeks is probably very, very accurate, if not on target. And really nobody knows, but based on our experience with other countries who have been through this, 6 or 8 weeks is a reasonable time frame.
All I would say is you guys have been, all of you, all of our women and our men know what the right thing to do is. So you're used to it. You're probably more capable of doing it than anyone in any other sport. You're at the top of the food chain when it comes to discipline. We got to stay disciplined and then be ready. We're going to get ready to compete this next season, but we got a break going right now. You know what the right thing is, and do what you do.
I would just close with that this is serious, but we will get through it, and we will. The question is when. A famous individual once said that we can't truly affect all of the things that we're confronted with, but we can certainly control how we respond to the challenges before us. And you all know that so well because you do it every single day. And then we will get to the other side of this and then be able to continue your sport and your activity and hopefully bring home a bunch of medals. So God bless y'all. Thanks so much for what you're doing. And I look forward to working with you in any way I can to be helpful.
Thank you all very much for your time. It was great meeting all of you. I appreciate all of your insight. Hopefully we can continue to have more talks in the future and continue to spread positive information and informative information. We just appreciate everything you guys are doing for us.